Afternoon, everybody, or evening as it would be. Sarah, Beautiful Disaster. Haven't heard from you in a while. Um, yeah, right now as you can see, I am about as exhausted and looking 34 as I think I ever have. I have pretty new nails and everything, so my hair's longer, a whole bunch of different changes. I want to talk to you a little bit about what's going on with the current crisis, because apparently, if you say what it actually is, YouTube has been, well, they've been demonetizing videos that have been talking about it. So, let me give you guys a little bit of backstory. So, my current profession, I am a healthcare slash social work professional working in Seattle, and I live in Everett, Washington. Work pretty closely with the senior and disabled communities. However, my background is in severe mental health with co-occurring substance use disorders and comorbidities in clients with, what do you call it? Complex care needs. I guess the best way of putting it. I've worked in severe mental health, co-occurring substance use disorders, domestic violence, sexual assault, and DD, so developmental disabilities. And now the bulk of my career for the last 8 years has been spent doing, not 8 years, since 2014, sorry, 6 years, has been doing senior services and senior and adults with disability services. So, I know what I'm talking about when I'm getting ready to tell you this. Currently, in Kirkland, Washington, is kind of been the epicenter of all this stuff going on with the current crisis, right? As far as Washington is concerned. As of this morning, we have 40 confirmed deaths in the state of Washington and over 650 confirmed cases of the virus. And it's going to keep going. So the governor announced yesterday and the day before in a press conference that they are going to be doing mandatory social distancing, no groups of over 250 or more, and those groups have to be able to abide by a 6 feet rule. Nobody can be within 6 feet of each other when you're in a group or outside. There have been, all of the schools in the entirety of the state of Washington are closed down until the 24th of April, K through 12, private and public. Most of the colleges have gone to online instruction now, including community colleges and universities. What else have they been doing? Lots of different things, right? There's a lot of new rules that came down for nursing centers and for adult day health. A lot of places have closed down, and the King County, all of the libraries have closed down. King County has shut down, sorry, I have been up since 1 o'clock this morning, and you can clearly see it. Sorry. They shut down the libraries. Any type of customer service interaction will be closed down on Monday. The schools are closed. Community centers are closed. Senior service centers are closed. Meals, so they're still assisting people, predominantly people with kids. The schools are going to be still handing out meals for everybody, which is a good thing, because this is I don't think anybody's talking about how families are being impacted by this whole thing. The closures and everything have been absolutely phenomenally devastating for people. For people that are low income, who are hourly workers, jobs have been closing down. The revenue in the city of Seattle for most restaurants and stuff is down anywhere between 70 and 90% at this point. So restaurants are closing down. Anywhere where people are working janitorial, anything like that, they're all closing for a temporary period of time, but still closing. So people have been laid off because their jobs can't afford to keep them. And then you also have people that are under mandatory quarantine who can't get to their medications, don't have access to groceries. It's an absolute shit show. And then you also have to take on that kids, some of the children are homeless children, and so the only real stable place they have is school, a place where they get a breakfast and a lunch every day, where they have, I guess now they're talking about, pretty soon the schools are going to be doing childcare, which is really great. For those of us who have been telecommuting, or for anybody who's been strongly encouraged to telecommute, childcare has been a barrier for a lot of people, so they've been relaxing on that. I can tell you that as of this morning, my mother and I went out. I'm still able to get gas and all those other things. Going to the grocery store is a trip. So for all those videos you're seeing of Costco, we found out today that's not people just lining up to go into Costco. Costco is limiting how many people are going into the store at a time. So those lines are actually people waiting for them to get more people out so that more people can go in. Would really like to clear that bullshit up. Yes, toilet paper's gone. And we can all joke about that all we want, but I think the reality is that when you're a poor family, getting access to necessities is hard enough as it is without having to worry about running out of things like that. So there's that. Toilet paper rolls cut in half work just as well. Just throwing it out there. So shelves are being wiped out of things. People are stocking up on hand sanitizer and cleaning things. It's an absolute wreck. I think if nothing else, it's an accusation of where we go when crap hits the fan. I think, I mean, if you've watched Walking Dead for more than 10 minutes, you know these things are an accusation of society, and this is one of those things. This is not going to be permanent. None of this stuff is permanent. It's temporary. We don't know how long it's going to last or anything like that, but for most people are, the whole point is to limit the pressure on the healthcare system and to keep people safe. That's it. I mean, really, in the great grand scheme of things, we need to keep that in mind. That's not limiting how bad this is, though. This is not a flu. Okay? This is not a flu. Yes, it is predominantly right now hitting people who are seniors with disabilities and with immunocompromised. That shouldn't be comforting to anybody. These are lives that are being lost. Families are being destroyed by the deaths of their loved ones, regardless. And the other thing, too, is that while I might not get sick, or if I do get exposed, it won't be that big of a deal for me, doesn't mean that I'm not going to bump into somebody who I might just randomly bump into that will then get what I have and die. I'm not willing to chance that, nor do I think most other people are. So this whole, if I die, I die bullshit needs to stop. The news out of Seattle doesn't really show how how things have been. The roads are quiet. Like, quieter than I've ever seen them. I've lived in Seattle off and on since 2014, and then came back in 2018, and I've never seen I-5 so clear that I go from downtown Seattle to downtown Everett in 25 minutes, ever. And that wasn't on the express lanes. I was taking a bus out of downtown Seattle last week, all of the days. So yeah, we're telecommuting, and yeah, we're doing all of these things with the hope that it'll slow down this whole thing. Life as we know it is changing, and that's just something we have to get used to. But don't for 1 minute think that this isn't coming. That this is some conspiracy or something like that. The media is not blowing this out of proportion. People are dying. Look at Italy. Look at China. Look at Korea. Look at Iran. All those places where this is already hit. The UK already is seeing an increase in cases. Go and look up the research. It's not just the media. And I really hate that we've turned this into this. We are now under a national emergency, and thankfully so. It gives us a lot of more resources. But it's coming. It's already here. So just prepare yourselves. Don't panic. Just prepare. That's what they've been telling everybody. We all need to be washing our hands and doing those types of things, but you also need to be taking care of yourself and everything else, and take care of the people that you love. So, don't downplay this. I think it's ridiculous that anybody's doing that. Do not downplay this. Wash your hands. Wash your face. Don't touch your face. I'm having a hard time reminding myself to do that. Just be mindful, but also realize that this is the type of crap that shuts societies down for however long until it's over. I don't know why everybody seems to think it's not that bad. It is, and it's coming. So if it's not to you yet, I promise it's coming. And hopefully we get through this relatively unscathed, but just be informed and don't be an idiot. All right? Take care of yourselves. If you guys have any questions, you're welcome to reach out. The other thing too, because I'm a case manager and my background is in case management, if anybody needs help with any type of paperwork, I don't care where you live. I know how to do most of it anyway. If you need help signing up for assistance, if you need help learning how to do unemployment applications, anything, rental assistance, looking up resources, whatever, hit me up. Let me know. I am happy to do research and to get things for people if at all humanly possible, and to help walk you through those paperwork, or that paperwork. I'm sorry, I'm still exhausted. So, thank you very much. Have a good one. Your PSA for the day.